In this video, I want to show you how you can assess all of the muscles in your lower limb flexibility and get an overall picture of your flexibility. If you like this video and you want to see more content from us on how to stay fit and healthy, then don't forget to like and subscribe to our channel. Anyway, over to the video. So, in this video, we want to be talking about assessing our flexibility, the amount of movement or stretch that we can get from our muscles. So what we're going to go through is each of the muscles individually, and then we're going to talk about some general flexibility tests that will give you a clear guidance of just how good your flexibility is. Calf area. Now in the calf area, which is the area below your knee at the back of your leg, we have two main muscles that we term the Gastrocnemius and the Soleus. Collectively we term the calf group. Now in order to work out the flexibility of those muscles, we use two variations of the knee to wall test. Now for this test, all you are going to need is a tape measure and a pen. To begin the test, what we are looking to establish is how much movement you have of your knee over your ankle joint, or what we term dorsiflexion. So start by placing your toe up against the wall. What you want to do throughout the test is make sure that you can keep the heel of the side that is being tested on the floor. What you now need to do is take the knee over the top of the toe so that the knee touches the wall without lifting that heel. That's something that you should be able to achieve. If you can't, straight away you know that you're very tight in that area. What you now want to do is start to slide your toe about a millimetre or two at a time further away from the wall and repeat the test. And what you're looking to establish is the furthest distance that you can get away from the wall and keep your knee touching the wall until that heel wants to lift. When you find this point, place the pen in front of your toe and measure the distance from the wall to the pen. And that will be your score for this test. You then want to repeat that test on the other side and compare your left to right flexibility or dorsiflexion that you have at the ankle, which will give you a good indication of, in particular, the soleus flexibility. What we want to do now is a slight variation on that test. Because I mentioned there's two muscles, what we can really do is highlight which one of those muscles might be the tightest or which one might need addressing. So for this next test, which is very similar, what you want to do is start in the same way. Place your toe against the wall, place your knee against the wall. What we're actually going to do now is test the other side. So with that back leg, what we want you to do, and the important thing now is that both heels stay on the floor, is start to slide that back leg further away from the wall. And again, the further away that you move that foot, and the important thing is that you're keeping all your toes in a straight line, is you'll start to feel the calf tighten up. Once you get to a point where you can't go any further without lifting the heel, that's when you know that you've reached the furthest distance that your calf is going to allow. Place the pen in front of your toe and measure the distance from the wall to the pen in order for you to understand that score. What you now need to do is change sides, so place the other toe against the wall, the knee against the wall, and then repeat the test. So the other side now, we're looking to slide the heel backwards as far as it will go. Once you feel like the heel needs to lift, place the pen in front of your toes and measure that distance. The hamstrings. The hamstrings are the muscles that are in the back of our leg above the knee, between our knee and our hip. Now there's a few ways of assessing the flexibility, but my favourite one is probably the sit and reach test because it allows us to get some objective data. So for the sit and reach test, what you want to do is sit down and place your legs straight out in front of you, slightly apart. You want to try and start with your back nice and flat. And what you want to do is take a pen and just place that at your heels so that your feet stay in line and behind that pen. Now, what you now want to do is stretch forwards as far as you can towards your feet whilst holding a pen. And you want to try and place that pen as far forward as you can. Now, it might be that you can't go as far as your heels. That's okay. Place the pen as far as you can go, and then we're going to measure. It may be that you can go further than the pen and the first pen. And again, as far as you can go to take that pen, once you can't go any further without your legs lifting from the floor, and that's the important thing, that the legs stay flat on the floor, that then is our maximum distance. Once you've placed both the pens on the floor, you can measure the distance. Now, if the second pen didn't go as far as the first pen, you can just place a minus score, which is okay. But here your goal is to try and get the score to be as low or as close to 0 as possible. If you've managed to go further than the pen, that's fantastic. And again, you can now give yourself a positive score in centimetres. So if your second pen was 1 centimetre short of the first pen, you'd have a -1. If your second pen managed to go 2 centimetres further than your first pen, you'd have a 2 score. The glutes. The glutes are the collective name for the muscles that sit around our hip area, or really the bottom muscles, the most powerful muscles in the body. So very important that we're understanding how flexible they are. Can be a big cause of lower back pain. So to assess your glutes, you want to lay with your back on the floor. The leg that is being tested, you want to place on top of the other leg. So the leg that isn't being tested, bend that up and place the foot of the tested leg onto that thigh, almost into a figure 4 position. Now, with the leg that isn't being tested, you want to lift that knee towards your chest so that you are going to take your foot with you. You will feel a pull around the hip and bottom area of the side that is being tested. The aim here is to take the leg that isn't being tested, so what I term the lifting leg, to work as close to 90 degrees as possible. Once you reach 90 degrees, that would be an expected normal range of motion. If you're unable to lift the leg that far, that means that you are tight in the area that is being tested. You would then repeat this test on the other side. The hip flexors. Now, to measure and assess our hip flexor test, we term this test the Faber test, or the figure 4 test. To simply do this, you lay with your back flat on the floor. The side that you are looking to test, you take that foot and you place it onto the other thigh. So that forms almost a 4 shape on the floor. You will notice now that the side being tested, the knee is raised off the floor. What you're looking to do is to drop that knee down towards the floor as far as possible. If you feel an uncomfortable pinching or painful sensation in your hip flexor, which is the area at the front of the leg, at the top of the hip, that then is an indication that you are tight in that area. This test does also assess the whole hip, so it may be that you feel a little bit sore in other areas, but that's helpful to know because that will show you where you are tight. The aim is to take the knee as far down towards the floor as possible. You would now repeat this test on the other side. The thighs. To assess the amount of flexibility we have in our thighs, or otherwise known as the quad muscles, the powerful muscles that we have on the front of our legs above the knee, you start by laying on your front or on your stomach. The aim here is to keep your hips nice and flat on the floor or on a towel, and you want to bring the heel of the testing leg up towards your bottom. Now, with the same arm, you can reach round and grab that ankle. The aim here is to have the ability to pull your foot so that your foot touches your bottom. It is expected that your foot should be able to touch your bottom. If it isn't, then you are tight in that area. If you are able to comfortably get your foot to touch your bottom, what you can now try and do is to lift the leg off of the floor and you'll feel that increase the stretch. The higher you can get here, the more flexibility you have through the thighs and the quads. You will now repeat this test on the other side. The groins, or adductors. The groin muscles are the muscles that sit on the inside of your legs. In order to test your groins, sit upright and place one leg straight in front of you. This is the leg that isn't being tested. What you want to do now is place a pen just next to your heel. Now, with the leg that is being tested, start that leg next to the other leg. And what you want to do is slowly take that leg as far away from the other leg as possible. you will start to feel this leg pulling in the groin muscle. You take this leg as far as you can. Once you are unable to go any further, you place a pen inside that heel. You can then measure the distance between the two pens to assess your groin flexibility. You would then repeat that test on the other side. The sit-down squat test. The sit-down squat test is a general test to really assess your overall flexibility. In order to do this, you need to be flexible through your calves, your hamstrings, and all around your hips. So it's a really good indicator of where areas that you might be tight. In order to do this, you start with your feet shoulder width apart. You then place your hands directly out in front of you. Now the aim here is to lower your bottom backwards and down, moving as close as you can towards the floor. In order to try and achieve the sit down squat where you can take your bottom to touch the floor. At some point you will feel a pull or restriction. As I mentioned, now this could be in your calves, in your hips, but that will be an indicator of areas that you're most tight. If you can achieve this is a great sign that you have good lower limb flexibility. The pancake test. This is again another general test of your all-round flexibility. So in order to do this, you start by sitting on the floor and you have a pen in your hand. You want to try and sit with your back right up against the wall, and then what you want to do is take your legs into a V position. Once you're in this V position, as far as your groins will allow, what you want to do is to lean forwards, and you want to try and place that pen as far out in front of you as possible. In order to be flexible and get that pen far, you will need to go flat, hence the pancake test. But this again will be a good indicator of where you feel restricted and where to target in order that you can get flatter each time you repeat the test.